clarify that when we talk about preventing rehospitalizations, we're not curing chronic disease. But what we are trying to do is to prevent those rehospitalizations that are absolutely preventable. Many times patients end up back in the hospital because we weren't able as healthcare providers to identify the incremental changes that are happening with the patient, intervene quickly enough, and then by intervening, prevent the patient back in the hospital. So with traditional home care, if you're seeing the patient on Monday and it's a heart failure patient and they're eating their, it's the Super Bowl, so they're having their chips and their beer and their pizza, and then we're not seeing again until Thursday. Now they have a 14-pound weight gain because of their heart failure. Now they're back in the ED because of that. Telemonitoring, we monitor the patients on a daily basis. We're seeing the patient the day after the Super Bowl when they've gained that 3 pounds. We're able to call the patient, find out what's going on, contact the visiting nurse, contact the physician, and get those changes made immediately, preventing a rehospitalization. We have stories and stories and stories about how we're able to do that. I often tell everyone that the most important days to monitor the patient is not the holiday. The most important day to measure the patient is the day after the holiday. So it's not July 4th, it's July 5th. It's not St. Patrick's Day, it's March 18th. Those are the days that are critical for us. So when we look at heart failure, we recognize that from our perspective and home care perspective, this is really low-hanging fruit for us. We know that this is a huge problem across the United States. Massachusetts is typical in terms of the amount of heart failure that we deal with on a daily basis and the cost to all of our healthcare systems. I think that what I like to talk about is that when we're looking at this nearly 700,000 new cases, and between 2010 and 2030, it's going to go from 273 billion to 818 billion. And this is, to me, this is like real money. We're talking billions of dollars. Then you're talking about real money, and you're talking about money that we can intervene sooner, utilize technology, and prevent these rehospitalizations, saving tremendous amounts. What does telemonitoring do? What we're looking to do is we're looking to involve the patient in their care. One of the other challenges we have with chronic disease, and especially with heart failure, is that by the time the patients really realize what's going on with them, they're far enough along that it's hard for them to really make those lifestyle changes that they need to make. 50% of people with heart failure die within 5 years of their diagnosis. That doesn't need to be a statistic that will be true 10 years from now, 15 years from now. We can teach people how to take control of their disease process, not to be a victim of their disease, but to take control of their disease process and live with a higher quality of life, utilizing less services by understanding what they can do to help be in control and to make the changes they need to make. But they can't make the changes if they don't make the connection. So if you don't make a connection between the hot dog and the weight gain, then you're not going to be able to understand how you need to change and not have that hot dog. We had a 91-year-old patient who we put on telemedicine, and he went on telemedicine because he loved his nurse. I really, to be honest. The nurse thought that this would help him. He was one of these guys that was in every 3 weeks, every 4 weeks, in, out, in, out, in, out. And she said, Mr. I think you would really benefit from this because I think it would help you if you could see what was really going on. And he said, Susan, I'm 91. Please, I've lived a good life. I don't need to do this. She said, no, really, I think this would help you stay out of the hospital. Because she said, what do you want to do? He goes, I really don't want to go in the hospital. So she said, please just try this. So he did try it. He learned to love low-salt Italian sausage. He learned to not add extra salt to his marinara sauce. And he stayed out of the hospital for 117 days. He stayed out of the hospital 117 days because what he did was he did what most of our patients do, which is have that aha moment. You mean I can have low sodium and I don't have to gain weight and then I don't have to feel bad? We've had patients say, I never knew I could feel so good and have heart failure. And it's only because of the telemedicine helps us teach them what they need to do in order to improve their lifestyles. We want to decrease unnecessary hospital readmissions and ED visits. We also found that if we're seeing the patient, this is just our program, but if we're seeing the patient every day, monitoring the patient every day, then we may not have to go as often for the nursing visit, and we'll be saving nursing visits, saving expense. This is our program. I want to talk a little bit about the fact that we have two different programs. additional telemonitoring with our home care staff. We are also fortunate in the Partners Healthcare system to have a program called the Connected Cardiac Care Program. And I want to bring this up because I think this can be a model for all of home care agencies to provide, if funded, for providing funding for telemedicine throughout the state of Massachusetts. The Connected Cardiac Care Program, our patients who have heart failure as a primary diagnosis, but are not homebound. So they don't meet the homebound criteria, so therefore they don't get traditional home health nursing services. And the way we're set up with no funding for telemedicine at this point, they don't get telemedicine. What Partners Healthcare System did was recognize that these patients that are free care, Medicaid, and Medicare patients are frequent flyers back in the hospital system. So the system said, what can we do to provide better quality of care to these patients and decrease these unnecessary rehospitalizations? So what they established was this Connected Cardiac Care Program. And what it is patients go on telemonitoring. They go on telemonitoring for a 4-month period of time. They receive one nursing visit to assess the patient in the home through medication reconciliation, and then everything else is done virtually between the telemonitoring nurse and the patient monitoring their vital signs and answering symptom questions. Over this 4-month period of time, we teach the patients the relationship between what's going on with them physiologically and their lifestyle. And we encourage them to become proactive members in their health care. So you know what you feel like when you have heart failure. We encourage you to call your doctor, tell him what's going on, and become an active participant, and recognize that you absolutely, as the patient, are in charge of your health care, and you need to pick up that phone and be an active participant. This is a model that I think should be available to all the patients with heart failure in the state of Massachusetts. I don't think that we should be constricted to the homebound criteria to offer this valuable resource. This is what's happened with this program. When you look at the statistics, there's been a 50% decrease in all-cause rehospitalization with patients on the CCCP program. If you look at patients getting primarily hospitalized for heart failure, from when they started the program, 39.8% down to 13%. That's a huge difference. And this is a year after finishing the program. Because what we wanted to look at was, that's great that while they're monitoring them, they're doing really well. Think of Mr. I, 117 days, we're in the home, he's doing really well. But can we help patients change the way they behave with their health care, and can that last? Because that's really the key. The key is to change behavior so that when I'm not seeing you anymore, you're still having the behaviors that you know are going to help you maintain your lifestyle. And so what we did was we went a year out after the program was over and still saw these dramatic reductions in rehospitalization rate. Telemedicine works. And I think that it's a benefit to the patients in Massachusetts and can save costs. Increasing quality of life and decreasing costs, it's a win-win situation as far as I'm concerned. To give you an idea, this is what our dashboard looks like. We have one nurse that can manage approximately 80 patients. They get a dashboard. The ones in the reds are the people that have vital signs outside the parameters that the physician has set for what is acceptable for that patient. And this is an individual patient. So we're looking at how the patient is trending as well. This is Rose. Rose is one of our patients. She didn't think she needed home care. We got her into home care. We got her into the telemedicine program. She then became no longer homebound, but still needed that little extra monitoring to make sure she understood how to manage herself. So she went into our CCCP program. She successfully completed the CCC program and now is being followed for a heart failure clinic without a rehospitalization for her heart failure. So this is a person who is utilizing the community services and staying out of the hospital. She now has plane tickets to go to Alaska. This is a woman who her goal was just to be able to do her activities of daily living and go shopping, and now she says, now she's going to Alaska. She was surprised at how easy it was to use. It became routine. She still measures her weight and blood pressure, and that's the goal. The goal is for when we're not there, you now understand the importance that you do it yourself. And she walks 20 to 30 minutes every day, unless it's icy, which I think is smart. I would love to say I walk every day 20 to 30 minutes. And this is another thing. When you have a disease like chronic disease like diabetes or heart failure that you can't exercise and you're going to be homebound and you're just going to like sit and watch TV until you die. And that's really not true. That is not the way the course of the disease has to be. And we want to encourage patients to live to the utmost until they're not anymore. That's the whole idea. You live until you die. And you live until you're doing that final decline down. But it's not in and out of the hospital, which is the way most of our patients nowadays have to deal with their chronic diseases. And this was, now she gets it. Now she understands what she needs to do in the relationship. And so she went to Foxwoods. That was another thing she wanted to do, she didn't think she could. And she brought her own dressing, water, fruit cup, and fiber just in case they didn't have her low sodium foods and the foods that she needed to be for her diet. Then they went to Atlantic City, then they went to New York to enjoy the Rockettes. I feel great and listen to my body now and rest if needed, remembering what the visiting nurse told me. So Rose is typical of our patients. I did have a video that or a DVD that I was going to show you, but we forgot the speakers. So, but I have a really lovely 5 minutes, so if anybody would like to see it, it really talks about it from the patient perspective, the doctor's perspective, the clinician's perspective in terms of what telemedicine can bring. We do behavioral coaching to empower the patient to gain mastery on their own disease process, that success. And this is just who we are. So I wanted to give you an idea, this is our telemedicine staff. But Partners is not unique. South Shore has telemedicine. Many agencies around the state of Massachusetts are doing telemedicine. Nobody pays for it. We could reach so much more people, and it is cost effective and really prevents unnecessary hospitalizations. Thank you very much for your time. And